while, and today we're going to be talking about omega-3s. Green Warriors, are you feeling puzzled about omega-3s, nuts, seeds, and healthy fats? Well, don't worry, because our expert is here to clear the fog and guide you toward a clearer understanding of these essential elements for a vibrant plant-based lifestyle. And I'm encouraging you, Green Warrior, to tell us in the comments, what conflicting advice have you come across regarding dietary fats, and how has it impacted your approach to nutrition? Let's get started in the chat, and we'll talk about that as we talk to Dr. Rogers about the dietary fats in question. And what we're going to do, he's prepared a wonderful presentation for us. But before we start that, we're going to take a little test and see what we know about dietary fats.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, Green Warrior, get ready. We're going to start this off with a little giggle. True or false, women have larger buttocks because it's an energetically efficient location to carry omega-3 fats for the body's growth and development, for the baby's growth and development. So what do you think, Green Warrior? Dr. Rogers, tell us about that.
Yes, because, our ancestors always worried about starving to death. And, the big challenges in life were to not starve and also to reproduce. So by carrying the weight, below the hips right there on the buttock and the back thighs, it's very energy efficient. I think that's also why women have relatively small shoulders in comparison with men. So they can control their sons until they're about, junior high age, hitting puberty, and then they're ready to go off with the men and do whatever the men do. But it would be a waste of, resources to have them have big, bulky shoulders. So there's a reason why men and women are designed the way they are.
Okay, so that's something for us women to keep in mind when we're self-conscious about things, that's the way we're designed. And just as you said, that we're designed to seek out these things, we can't fault ourselves when our brain is trying to direct us to eat foods that are deleterious to our health because they're designed to hit those.
Oh, I would even, excuse me, I go one thing further too.
Yeah.
The other reason women are designed like that is it's a signal to the man's brain, okay? When he sees that the buttocks and the hip area are wider than the waist, that isn't attractive to a man, okay? We can't even help it. It just happens. And then the question is, well, why? And I think it's because an indicator she's fertile. If she's pregnant, it doesn't look like that. And usually when a woman gets much older, a lot of times they lose their shape. Not all of them, but a lot of them do. So it's an indicator to our brain. She's probably fertile, because for a man to approach a woman is dangerous, okay? She might, freak out on you. Her husband, her brother, boyfriend, whatever, might beat the crap out of you. So I think our ancestors basically said, you don't want to risk approaching a woman in a romantic way unless, you got a chance to make a baby out of it. Otherwise, why take the risk?
Yeah, that makes sense. And it could even happen today, too. Okay, let's go with our next question. Green Warrior, type in your guess for the answer. True or false, doctors prescribe fish oil mainly to lower triglycerides in the blood. Okay, Dr. Rogers.
Yeah, that's a big thing they all sort of have been trained to believe in. Because I asked my internal medicine buddies, why do you prescribe this stuff? And they're like, well, it lowers triglycerides. Yeah, but we're going to talk more about what else it does in a little bit.
Yes, exactly. There's so much conflicting information. I'm so glad that you're here to give us the facts and the research. All right, the next question, Green Warriors. True or false, omega-3s have a mild anticoagulant effect similar to aspirin? Dr. Rogers?
Yes, they do. And I can tell you, both aspirin and omega-3s, it's a mild effect, though, okay? Before I became a neuroradiologist, I was an imaging-guided surgeon, interventional radiologist. I did many, many thousands of procedures, tons and tons of chest tubes, abscess drainages, dialysis catheters, all kinds of things. And what I'm trying to say is I never change anything based on omega-3s or on aspirin. I just do the case. Spinal taps, myelograms, whatever. I ignore the bleeding, anti-bleeding effect of omega-3s and aspirins is relatively mild. Like I said, never changes anything I do. I've never had a bleeding problem because of it. Versus some of these other medicines like Plavix. Plavix is a powerful medicine. I've had bleeding problems with Plavix. I put in a biliary drainage tube and I had to hold pressure for like 2 hours. Okay, I've had chest tubes bleed when I've been sort of forced by clinical circumstances to put in a chest tube. And I'll sit there holding pressures for about 2 hours, which is about the last thing in the world I want to do. I'm pretty busy. So what I'm trying to say is, yes, it's an anticoagulant effect, but it's relatively mild for omega-3s and aspirin.
Wow, these drugs are powerful, and we really need to think about them before we decide on whether we want to include them in our life. Okay, true or false, Green Warrior? The methylene bridge carbon in omega-3s is prone to oxidation, leading to lipid peroxidation. Now, perhaps you don't know the answer to that question, but Dr. Rogers will explain it to us. Dr. Rogers?
Yeah, so whenever you got double bonds in a PUFA is polyunsaturated fatty acid. There's always one carbon in the middle. So call it the skip carbon in the middle, away from the double bonds. And this carbon is has only a loose grip on its hydrogen because the double bonds are sort of pulling on the electrons, if you will. So that's a spot where oxygen comes along, and it's hyperreactive for oxygen to interact with that hydrogen there to sort of steal the electrons. A lot of pathogens, pathologic molecules are electron stealers, if you will. And so what I'm saying is, there's all this hype about how great omega-3s are by the people who are trying to sell them. But when you look at one of these giant molecules, like DHA is a giant molecule in comparison with some of these other smaller things we often deal with. What I mean by that is like a C22, 6 double bonds. 6 double bonds means there's a methylene bridge in between every one of those double bonds. So that's extremely high risk to undergo lipid peroxidation, a harmful chemical reaction. And so that's one of the reasons why I'm not that big a fan of this whole DHA EPA thing. I think it's kind of ridiculous, by the way, because there's tremendous risk of rancidity, spoilage of these fats, creating toxic byproducts that are harmful to the body. And I'll go into more detail why I say that. But yeah, there's good reasons for saying that.
Okay. True or false, saturated fats are atherogenic, promote or contribute to the development of atherosclerosis, and are often found in fish. Okay, Dr. Rogers?
Yeah, so that's the other thing too. Everybody says, oh, fish are so good for you. Fish are so good for you. They've got omega-3 fats. What they leave out is, first of all, omega-3 fats are not that great. They're not as wonderful as people pretend they are, the people selling them. And the second thing is they got lots of saturated fat. I think fish are very unhealthy, and it's a big mistake to eat them. There was an interesting book. It was something about mercury. The author's name was Hightower, Jane Hightower. She was an internal medicine doctor in the San Francisco Bay Area. What I thought was funny about it was there were all these yuppies who were becoming demented at a young age, in their 40s, 50s, and nobody knew what to do with them. Nobody could understand what was wrong with them. Is it genetic Alzheimer's or something? So they sent these patients to her, and she had a curiosity about mercury, and she started testing them, and it took a little while to figure out how to do it correctly, but all these yuppies were becoming demented in their 40s and early 50s from eating too much fish. So they were trying to help themselves by eating fish, and I think it's primarily because of the mercury contamination. They're making themselves demented.
Yes, that's something that we have to really take into consideration. And even when they have farm-raised fish, they don't realize, a lot of people don't realize that they are not health promoting as well because of those saturated fats. And sometimes they call the salmon fresh caught salmon, and it's only because they're on the fish farm and they're released from one tank to swim into another, and then they net them, and they are allowed to call that fresh caught. So got to do the research, and that's why we have Dr. Rogers here to help us out and to learn more. So about fish, Green Warriors, true or false, eating more fish can solve weight-related problems? Dr. Rogers?
All fat is obesogenic. It's like it's the highest concentration of calories. Fat's like 9 calories per gram. It's very fattening. The higher the percentage of calories from fat a population eats, the fatter the population will be. So I actually think fish is I'd recommend don't eat any fish at all. And they're typically fried and then salted. And besides all the, the omega-3 fat, the sat fat, frequently contaminated with mercury, PCBs, estrogenic chemicals, etc., I don't think there's any reason to eat fish.
Okay. True or false, insulin resistance syndrome is associated with increased omega-3 intake? Dr. Rogers?
Yeah, that's another thing that's kind of funny. Oh, you lower triglycerides, but you increase insulin resistance, which is the underlying causative problem with diabetes. So yeah, it's nice to lower your triglycerides, but you're just creating a new problem. So I don't think there's any net benefit from taking these omega-3 supplements. And they're obesogenic. They cause a person to gain weight. Diabetes increases the person's risk of hypertension, coronary artery disease, stroke, kidney failure, blindness. So I think it's kind of a big joke, quite frankly, omega-3 supplements.
Okay. Well, Green Warriors, what about fish oil? Do you think that it increases the risk of cancer, particularly prostate carcinoma? Dr. Rogers?
Yeah, that's the other thing is that fish oil and these omega-3 fats, the DHA, EPA, they're immunosuppressants, okay? From them are made some sort of anti-inflammatory prostaglandins, for example. But when you get them in excessive amounts by supplementation, in a sense, you're overdosing on them, and they can lead you to having immune suppression. Now, if you have an autoimmune disease, that could potentially be beneficial to suppress your symptoms. I would try to fix the leaky gut first, but if it didn't work, suppressing leaky gut and avoiding a few other common autoimmune-inducing chemicals, then I would think it'd be reasonable to try one of these fish oil omega-3 type approaches, or not necessarily fish oil, maybe algae omega-3s or something. It'd be reasonable in that context, but there's a price you pay. When you suppress your immune system, you're more vulnerable to infections, and you're less able to control cancer. There's increased prostate cancer in men. There's increase in animal studies, increased metastatic cancer from several different types of cancer, including colon with metastases to the liver. And I would expect that, it just hasn't been studied, that there's increased risk of other types of cancer. You weaken the immune system, you weaken your body's ability to prevent cancer.
And that's something that we really need to learn more about. And I'm glad that you mentioned that. Green Warriors, true or false, you can get sufficient omega-3s from plant foods without eating fish. Dr. Rogers?
Yes, there's plenty of omega-3s in plant foods. That's where the fish gets them in the first place. The fish gets them from eating the plants. So animals don't make them. Animals can't put a double bond in the omega-3 position. So it comes from plants anyways, and there's a good amount in plants. So we get what we need, and the plants is the perfect package for it. That way it comes into your body and it's sort of protected, if you will. Whereas when it's sitting on a shelf as some type of supplement, it has a much higher risk of being oxidized to these lipid peroxidation products, to go rancid, if you will.
Yeah, I agree. I remember before I adopted this lifestyle, I was taking fish oil, and oftentimes I would feel a burning in the bottom of my throat by my neck, or even, feel like a little indigestion. And I wondered if I thought it was maybe the brand that I was in. Maybe I should try a different brand, but probably it was rancid. And that was probably why my body was reacting that way. Yeah, it's very important to know that, and especially about oils as well. They can be rancid too. Okay. True or false, humans are designed to consume large amounts of fat on a routine basis. Green Warriors, type in your guess. Dr. Rogers?
I don't think so. I think we're designed to eat a low-fat, plant-based diet, with the vast majority of our calories coming from plants. A little bit of fat here and there, fine, but, as soon as you start eating fat, any type of fat, there's all kinds of metabolic problems that start to happen.
Right. And that's the thing that we're trying to get to the bottom of today. And you're going to be giving a presentation with more details so that we can learn about this. Okay, true or false, thick blood caused by fat intake increases the risk of clot formation. Okay. Dr. Rogers?
Yes. So basically, the purpose of your blood pressure is to get blood to the top of your brain. It's the highest thing up when you're standing against gravity that you have to pump blood to. So basically, the thicker your blood, if it becomes like a milkshake instead of like water, the higher your blood pressure has to be. And fat makes your blood thick. If you look at the pictures of, like there was that movie, The Game Changers, and they had a picture, you could see it. And you could also just type this in your browser. The fat, like one test tube here, the other test tube here, when the fat is in the blood after a high-fat meal, you'll see it becomes very opaque. Normally, you can see through the plasma, the upper part of a test tube when it settles out. But when it's fat, you won't be able to see through it. And when the blood's flowing, it starts to sludge. You can call that blood sludge from the chylomicrons, or you can call it rouleau formation with increased LDL cholesterol sticking the red blood cells together. But by sticking the red blood cells together, it's making the blood thick. The other word for that is increasing blood viscosity. And that means the heart has to pump harder. And the blood is more predisposed towards clotting. And you don't want that because that increases the risk of, a cardiovascular event is when you clot off a significant blood vessel.
Okay. True or false? Fat intake decreases oxygen delivery to tissues. Dr. Rogers?
Yeah, this has been shown back around 1960 in the Peter Quoll papers. There's about 15 and 20% drop in the oxygen delivery to tissues. Also, Roy Swank had shown this, like, for example, in a hamster brain, when fed a high-fat diet, he showed times where you could be dropping the oxygen delivery to the cells by as much as 30%. And that's relevant because if you have the metabolic rate of a neuron, let's say, relative to its oxygen and glucose delivery, you get too big of a gap between the two, the neuron could die, go into what's called programmed cell death from apoptosis. Also, there's the Warburg theory, Otto Warburg theory of cancer formation, that prolonged hypoxia, whether chronic or intermittent, it can cause the cell to transform from being the typical aerobic cell to one that primarily relies on anaerobic metabolism through glycolysis and become like a bacteria and become cancer. That's the Otto Warburg metabolic theory of cancer. And I think it's much more accurate and useful than the more widely known genetic theory of cancer, also called the SMT, the somatic mutation theory.
All right. True or false? Insulin resistance only affects the body and does not impact the brain. Dr. Rogers?
Yeah, and that one kind of makes me smile because if you look back at all the medical books, getting your medical textbooks out, they're going to tell you that, the brain is not, affected by insulin resistance because it has like glucose type 1 and glucose type 3, glucose transporters that are not insulin dependent. But that's an incomplete statement. The books, all the conventional books are wrong. I consider them kind of stupid and out of date and incorrect. There's also glucose type 4 transporters in the hippocampal neurons, and those are insulin dependent, dependent on insulin to be able to take up glucose. So when a person goes from 0 to 60 miles per hour, walking down a path in a forest or a jungle, and all of a sudden they see, a tiger's coming at them or something, so they got to run and climb a tree, they have to very rapidly ramp up the metabolic rate in the active neurons as well as, of course, in their muscles. And so they need all of a sudden to get more glucose into those cells. And they're not going to be able to do it effectively when they have insulin resistance because their glucose type 4 transporters aren't going to work. So it's a problem, and it's one of the things that contributes to cognitive decline in diabetics, people with insulin resistance.
It's so interesting how these fats affect so many different systems in our bodies. True or false, Green Warriors? Polyunsaturated fatty acids, PUFAs, put individuals at risk for lipid peroxidation, potentially damaging various organs.
Yeah, so this gets back to that concept we were talking about, the methylene bridge carbon in the middle between the double bonds. And so basically, I'll just use a couple pens here. So let's say these two red pens are, the red pen in the middle is the methylene bridge carbon sticking up here. And then the two greens will be the double bonds right adjacent to it. So what I'm saying is the more of these that you got, these methylene bridge hydrogens there, the more likely you're going to undergo lipid peroxidation formation where oxygen reacts with that. You get two oxygens right next to each other stuck on it. That's a peroxide. They're stealing electrons from the molecule, and they kind of convert it into its own version of a free radical. And then it'll be like the initiator of a chain reaction and react with the molecule that's next to it. So a lot of molecules can be damaged that. Plus the problem with cooking oils like those omega-6 cooking oils is that they'll very routinely have lipid peroxidation damaged omega-6 type fats just from the processing and from the cooking. And then when you ingest them, you get these distorted, adulterated, damaged omega-6 fats, and they go around your body causing more damage. It's not a good thing. That's why I won't eat anything with oil in it, not one drop.
Right. And that can be difficult to do if you're not eating a clean diet at home, and especially if you're out and about. So it's really something that even a small amount can make a difference. And I think that especially for people who are older, they've been going at it at the standard American diet for such a long time that every drop can potentially mean a change. So they really have to be on their watch and try and be very diligent. So let's just settle it. True or false, Green Warriors, the higher the percentage of calories from fat, the more likely a person is to become fat. Type in your answers. And Dr. Rogers.
Yeah, everybody talks about sample set. What's the size of the sample set? How about 1 billion, okay? 1 billion out of 1 billion Asian rice eaters are skinny, okay? You're not going to find a fat person amongst populations where they're eating about 85, 95% of their calories from white rice, okay? Because it only has 1% of its calories from fat. Same thing with sweet potatoes, same thing with regular potatoes. Only 1% of calories are from fat. And people who eat that as their main staple, they're skinny.
Yep. And that's what it all comes down to. It's very, very simple. And we really have to learn a lot. And we're going to be learning a lot about dietary fats and omega-3s and nuts and seeds and all kinds of things that in this presentation that Dr. Rogers is about to show us. So we should get started with that, Dr. Rogers. Do you want to share that to your screen? And, and while Dr. Rogers is setting that up, Green Warriors, what conflicting advice have you come across regarding dietary fats, and how has it impacted your approach to nutrition? So let us know in the comments, because I've been getting a lot of messages from people asking me about dietary fats, and that's why we're having Dr. Rogers on the broadcast today, because this is something that can be a little controversial and confusing. So let us know in the comments how it's affecting you. And we'll wait for Dr. Rogers to get his.
Okay, can you see my slides?
Yes, now I can see your slides. So let's get that up.
Okay, I'm ready to go here. I got about an hour talk, maybe a little more than that.
Excellent.
Okay, so here is the first question is, why are hospital workers so fat? If you go to a health club, most of the people working there behind the counter, they're pretty fit looking. They're pretty healthy looking. You know, the guys are probably lifting weights. The girls are probably trying to be thin and healthy. And that's kind of the way to be in a health club. And what I'm trying to say is, you go to a hospital, it's supposed to be the place to help you find you health, bring your health, restore your health. And you're going to notice most of the nurses are fat, and lots of the doctors, techs, and secretaries are all fat. So what I'm saying is, if somebody's fat, they're at increased risk for diabetes and hypertension and all the Western diseases, coronary artery disease, you name it. So if they don't know how to take care of themselves, how are they going to help you? And the reason the doctors don't know, and then the rest of the staff doesn't know either, is because nutrition, epidemiology, and toxicology, the 3 most important subjects for health, are not taught in pre-med or med school or nursing school, so they don't know them, okay? And the other thing is, there's a lot of issues with how to feed a patient, and they're just not known. I mean, I see all kinds of patients, you know, every hospital I've ever worked in their post-operative phase being fed these high-fat diets and other stupid things. All right, now, one quick thought was, what should happen to all these colleges? Tons of colleges are going out of business because online education is cheap, and so fewer people are going to be going to these colleges, and I think we should turn them into fat camps, and I would love to work at some of these places. So I don't want to do the business. I'm not a businessman, but if somebody wants to run a fat camp, I would be happy to help out with that. They're perfect. They got cafeterias and dorms, lots of spots to walk, lots of places to read and study. Be perfect. Okay, we already know what works. If you go back to the Walter Kempner Rice House stuff in North Carolina, Durham, North Carolina, Duke University, he had the patients stay on the campus of the hospital college area. They called them rice houses. They would weigh in the morning in front of each other. They'd have a picture on the wall, the centenarians of everybody who lost more than 100 pounds. They would eat the healthy food. They would, talk with each other and the staff, and it worked incredibly well. Tons of people, got their blood pressure from the 200s down to normal. Lots of diabetics, hypertensive, reversed their retinopathies, and a whole bunch of other benefits. Type 2 diabetics cured, et cetera. So we know that works, okay? We also know the Esselstyn diet works for reversal of coronary artery disease. And he made the metaphor analogy that, the sword of Damocles this was the king, this was the poor man who wanted to be the king. He said, I will show you what it is like to be a king, as if the sword of Damocles hangs over your head all the time. You're always worried about something. So an educated person who studied health would be worried about a myocardial infarction or other Western type diseases. But the point that's been made is, once you know the low-fat diet, you don't get coronary artery disease. The sword of Damocles is no longer over your head. You can relax about it, okay? Oh, I did jokingly say that the only thing I don't worry about disease. I worry about pissing people off, because People don't like it when you tell the truth about disease. When I was young, I was a really good athlete, and people liked me. You know, everybody liked me for being a good athlete, okay? But then when I became really excellent scholar, I noticed a lot of people don't like you. And you say, oh, that's BS. Why wouldn't they like if you're a good scholar? You don't understand. If you walk into a group of endocrinologists and you tell them all their books are wrong and they're stupid and they're not treating their patients as well as they should, they don't like that. And it's the same in lots of fields. As Plato had said, no one is more hated than he who tells the truth, okay? But if you want to be good, you got to tell the truth. So that's the pitfall in academics and health, medicine, conventional medicine especially, that you sort of pay a price for telling the truth. But if you don't tell the truth, what good are you doing anyway? So you got to do it. Okay, so lecithin diet is like the 10 commandments of how to keep your arteries clean. And also, this is also a question comes up, because you see a lot of, I'll jokingly call them posers on the internet saying, oh, keto, carnivore, paleo is a great diet, you know, all this and stuff. And I would tell them is, look, the only diet, and this is an important one to know, this is like one of the major slides in this whole talk. The low-fat vegan diet is the only diet shown to reduce coronary artery disease. Okay, it's proven. You can reverse coronary artery disease in humans and in animals, okay? And why? Because it's the best diet. And I jokingly will say, you know, the old guy, he's about 90 years old, Esselstyn, he's like an Old Testament prophet. Okay, says this is how it is, no oil, not one drop. And people will say, oh, that's so harsh, no oil, not one drop. And my attitude is like, look, the vast majority of people I see over 60, they're messed up, they're just deteriorating, and they're never going to get better, and it's sad and pathetic, okay? And their families cry all the time. And it's like, look, you've got a chance here to prevent this stuff, so take it or leave it, you know? That's what works, okay? And I jokingly say we've already found the promised land of health with the low-fat vegan diet. And there's this tremendous pressure, I see it over the last couple of years, pushing people to eat more and more high-fat plant foods. I almost think what the big money wants is to move the public towards eating plant-based, but they don't want them to be healthy. They want them to eat high-fat plants. And so there's all this push about all these nuts and seeds and omega-3 supplements, avocados and soy and olive oil and chocolate, all this high-fat stuff. And I'm saying is, why get yourself expelled from the promised land of health? You know, you're going to be wanting the desert another 40 years. I don't think that's what you want. Okay, and I'll go back to some old-time nutritional scholars, and like one of the guys I was pretty impressed by was Nathan Pritikin. After a thorough review of all the literature on dietary fat, he said fat is bad, and I would agree with that. I don't think you can win with high fat in any way. Your saturated fat is atherogenic. The polyunsaturated fats, you know, omega-6, omega-3s, end up being atherogenic. The MUFAs, monounsaturated fatty acids like olive oil, predominantly MUFA, it ends up being atherogenic, increasing insulin resistance and diabetes. So I don't think you can win with that. And what I like about fiber is dietary fiber only comes from plant foods. There's zero fiber in meat. It is converted in our gut to short-chain fatty acids, and the short-chain fatty acids prevent leaky gut. And that means they also prevent opening of the blood-brain barrier, because whatever opens the gut tends to open up the blood-brain barrier as well. So they protect you from postprandial endotoxemia. They protect you from autoimmune disease. They protect you from, you know, non-specific inflammation and all these diseases, irritable bowel syndrome, Crohn's disease, ulcerative colitis, etc. Now, the food companies are smart, and they've got lots of money, billions of dollars budget, some of these food companies. So they do a lot of research, and they figure out something called the bliss point, whereby they add just the right amount of salt, sugar, and fat. They test it on an audience of consumers, and they get just the right mouth texture and feel, throw in some glutamate there, and they get people addicted to the foods. It's, you know, designed to be that way. And so that's why a lot of people have a hard time giving up the addicted food. But once you realize you're sort of deliberately being tricked and poisoned, then, you know, hopefully you'll be smart enough to stop with that stuff. The other thing is, take a look at how much fat there is in food. We talked about rice, potatoes, sweet potatoes, all having 1% of the calories from fat. Look at these other foods. Nuts are routinely 70 to 90% fat. That's an incredible amount of fat, okay? Right now, nuts have sort of been, you know, given a health halo by the industry-funded research, and they're very overrated. There's also this big promotion of eating flaxseed, and I have not thoroughly studied flax, but I have zero interest in it. I'll just tell you why. It's off the charts estrogenic. It's far, far, far more estrogenic than soy, and soy is already thousands of times more estrogenic than other foods. Okay, my background is I was a college wrestler, okay? And the last thing in the world I want to eat is estrogenic fat, okay? Even though that's sort of like the thing in the modern world, you know, turn yourself into a woman. I have no interest in doing that. Okay, so estrogenic fat does not appeal to me for my diet. Okay. And then let's see, these other plant foods, some of them got a little bit more fat like oatmeal, but 16% still not bad. I would eat oatmeal. It's kind of a wet food. I'd eat that early in the day, breakfast or lunch, but I wouldn't eat it later at night or you're going to have to wake up the void. But anyways, I'm just showing you these plant foods, other than soy, which is about 40% of the calories from fat, these plant foods tend to have very low, much lower amounts of fat in them. The lowest percentage of calories from fat amongst the beans would be the lentils. They're only about 3%. Black beans about 4%. Peas, green beans about 5%. That's all great. Garbanzos are a little fatter at 13, but it's still not bad. Okay, starches are just a really good way to go to keep yourself healthy. Okay, the nomenclature. Okay, basic molecules with just carbons and hydrogens are called alkanes. And which ones are worth knowing? You're going to hear this all the time, methane. So you should know when it's got 3 hydrogens on it, it's a methyl group. When it's got 2 hydrogens on it, it's a methylene group. This is going to come up again a lot, methylene. So you need to know that. Carbon with 2 hydrogens is a methylene group. We're not going to go into too much of this stuff, but there's just a few basic things you should know. Okay, the 3-carbon backbone of a triglyceride fat is really sort of like a propane 1,2,3-triol. So that's 3 carbons, and there'll be 3 hydroxyl groups on it. Okay, in general, fat is dry. When I say fat is dry, what I mean is you can store a lot of energy and you don't need any water because it's hydrophobic. Your fat cells are high caloric density, dry storage, and that enables you to store tons of energy. Versus if you look at carbohydrates, like the glucose stored in your liver as glycogen, that's hydrated, about 3 molecules of water per every molecule of glycogen, in the sense that if you ever look at a liver, take a look at a CAT scan of the abdomen. Okay, the liver is this giant thing, it's like bigger than a football, all right? And that's where you store all your glycogen. You also store it in your skeletal muscle, but what I'm trying to say is it takes lots of body weight to store glucose because you have to store it with all this water, so you can't store that much of it. You know, our glycogen supplies can last us about 1 to 2 days, really about 2 days. They start being shared, of course, with gluconeogenesis, you know, the production of glucose in the liver from amino acids, for example, if we fast for 2 days in a row. But that's an important point. Carbohydrates are wet storage of energy and can only be done in small amounts. All right, just a little bit more nomenclature. What's worth knowing here? What you would use the ethyl or the ethanoic acid right here. The ic means carboxylic acid. You can also call it acetate or acetic acid. So that those kind of interchange. Ethanol, like ethyl alcohol. All right, we don't need too much of this. Here's a slide that's a little more important. This is the carboxylic acid. Carboxylic acid is when there's a double bond to the oxygen and then there's a hydroxyl group, and that part is charged on it because the electronegativity, the desire of the carbon to hang on to electrons, is different than that of oxygen. Oxygen is a much more powerful electron grabber, if you will. So because of that, there's a polarity of the charge. The electrons are pulled towards the oxygen, and that's polar, soluble in water. The hydrophobic tail of the fatty acid is just carbons and hydrogens. They have a similar electronegativity, meaning a similar desire to pull electrons. And because of that, it's nonpolar, non-charged. And this makes the entire fatty acid what is called amphipathic, like an amphibian. An amphibian can live on land and water. And what this means is this part is soluble in aqueous, this part is soluble in fat or in oil-like solutions. And because of that, it can have special properties where it can interact with both solutions a little bit. But it's much more hydrophobic, fat-loving, than it is water-loving, because the nonpolar tail is much longer than the little polar head there of the carboxylic acid. Okay, for other fats, let's talk about when you have a double bond. So here's a saturated fat, meaning it's saturated with hydrogen. You can't add any more hydrogens to these carbons. Okay, that's called sat fat, no double bonds. MUFA is a monounsaturation. So unsaturation is when there's a double bond. There's one, and that's the main fat in olive oil. The vast majority of fat in olive oil, about 70% or something, is monounsaturated, MUFA, all right? PUFA is polyunsaturated fatty acid. Okay, and this is, by the way, is the methyl end. It's also called the omega end, and it can be symbolized with this like omega that looks like a W or an N. This is the carboxylic end. You can call it the carboxyl N. You can call it the carbonyl group, a carbon to double bond oxygen to carbonyl group, sometimes called the delta N. I just give you all this terminology so if you ever try to read any papers on it, you'll be able to blow right through the terminology, okay? So here's sort of a classic fat here. Let's say this is a C18, and it's got the double bonds at the omega-6 position. So you count from the methylene, 1, 2, 3, 4, 5, 6. Okay, so this is an omega-6 fat. Here's the methylene bridge carbon, meaning that there's no double bond to it, but it's right in between these two double bonds. Double bonds are always spaced like this, with one intervening free carbon in the middle. And this is the hydrogen that can be plucked off for lipid peroxidation. Okay, and so this is linoleic acid, C18-2. It's the most common omega-6. It's the only essential omega-6 fat. So you're actually going to need to know that. C18-2 meaning 18 carbons and 2 double bonds. W6 means that the double bonds at the 6th position and the 9th position. You don't need to know 9. You need to know it's at the 6th position. That's linoleic acid, your classic essential omega-6 fat. Okay, we'll talk about phospholipids. These are what make up all your membranes. They'll have the outer heads that are polar, facing the extracellular matrix, facing the cytoplasm, and then the inner tails that are hydrophobic, okay, fatty acids. All right, and typically you'll have, let's say, one saturated fatty acid, and then you'll have another one that has a double bond in it, a moofer or a poofer or whatnot. They cause a little bit of a bend in the alignment of the molecules and the structure of it, so they push the adjacent fatty acid away from them a little bit. They fluidize the membrane a little bit. Then you're going to have a phosphate, and it'll be attached to one of these other groups here. We're not going to talk about that too much today, but this is your phospholipids for making up all your membranes. This will be a little bit relevant when we start talking about oxygen transport, but it's not as big a deal as people used to think. Okay, now we're talking about sat fat, which basically means animal food, and there's lots of problems with sat fat. The little bit you get from eating plants is plenty. The more fat you eat, the fatter you get. It raises your LDL cholesterol, so it increases your risk of atherosclerosis, heart attack, stroke, impotence. It thickens your blood, raising your blood pressure. So you don't want to eat this in large amounts. That's why I recommend not eating any animal foods whatsoever. And people sometimes say to me, well, indigenous populations, they all eat some animal foods. And that's true. Most of them eat anywhere from, 3 to 10% animal foods. And I think in the wild, that's just fine. But they've grown up like that their entire life. Versus if you've eaten the standard American diet for a couple of decades, you've got problems with your health that you want to detoxify, if you will. So you don't want to eat any of it. Plus, it's good to it's a big step in health to go 100% vegan. I think it makes it a lot easier to follow. People who say, well, I'm cutting down on meat and oil, they tend to have bad outcomes and don't do so well. I've seen a lot of them, trying to get themselves out of kidney failure and diabetes and hypertension. And unless they go 100%, it's hard for most of them to just don't make it if they don't go 100%. Okay, diabetes increases something called advanced glycation end products. We'll talk about that a little later. So what I'm saying is once you get diabetes, and it's very common, super common, prediabetes, diabetes, you start just creating all these secondary problems. And then you get elevated insulin. It's mitogenic, meaning that it causes cells to replicate at a faster rate, increasing the risk of cancer growth. Diabetes also suppresses the immune system. So the net result of excessive saturated fat intake is you're going to suppress your immune system, be at increased risk for cancer, have less ability to prevent an infection. So it's not good. Less ability to deliver oxygen to your tissues. It's not good. Here's a whole bunch of research studies showing the problems with saturated fat. If you want to read more, you can look them up here. Like I said, it decreases oxygen to the tissue. This is what I was referring to, the scene from the Game Changers. Normally when you have you've drawn blood and you put it in a test tube, RBCs sediment out to the bottom. This is the WBC, the white blood cells, the buffy coat. And here's the plasma. Usually you can see through it. You can't see through it when it's filled with fat. It makes your blood thick. Typical RBC is about 5 microns. Capillary, typical RBC is about 7 microns. Capillary is about 5 microns. So it has to deform a little bit to pass through. When you stick the red blood cells together with fat, for example, from the chylomicron blood sludge or with LDL cholesterol forming a bridging molecule, then you're like pumping a submarine sandwich, a thick milkshake-like material through your blood rather than a water-like substance, and blood pressure has to go up. Higher the LDL cholesterol, higher the blood viscosity. It's a bridging molecule, can stick these red blood cells together. Red blood cells have a zeta potential, meaning a negative charge on their outer surface, and that gets them to repel each other, which is good. That's what you want, so they don't stick together and clot unnecessarily. But when you have elevated amounts of these bridging molecules, they can stick the red blood cells together. It's called overcoming the zeta potential. And LDL cholesterol does it, and that's why LDL cholesterol is the main risk factor, because Americans eat high-fat diets, have high LDL cholesterol, and that predisposes them to, and by the way, atherosclerosis is a blood clot. You need to know that, because once you understand that atherosclerosis is a blood clot, then you will be able to make sense out of the rest of the literature on atherosclerosis. I did a fellowship back in the 1990s in imaging-guided surgery, interventional radiology, with the emphasis on vascular interventional. And I've been interested in atherosclerosis for many, many, many years. Okay, and I've studied it in great detail. So IgM antibodies will also overcome the zeta potential. Fibrinogen, the clotting protein, overcomes it. Being stressed out elevates your fibrinogen. It's an acute phase reactant protein from the liver, so that'll increase your risk of clotting. You can make sense out of, the way you teach somebody what does stress do. It's like being chased by a tiger in the dark. Well, you want your blood to clot a little faster in case the tiger scratches you, is a way to remember that. But psychological stress will elevate fibrinogen. Caffeine elevates fibrinogen. Sleep deprivation elevates fibrinogen. So they make your blood more predisposed to clotting. Okay, uric acid is elevated by eating meat, also by eating high fructose corn syrup. So that increases your risk of clotting. I'm just going to show you. This was actually the work of Roy Swank, and he found that the more saturated fat you feed patients, the higher the risk of multiple sclerosis and multiple sclerosis progression. He followed his patients for over 34 years. It's kind of incredible stuff. So this is just showing the higher the sat fat, the more multiple sclerosis the population had, and the worse it was. And then he did all kinds of work studying the effect of fat, especially saturated fat, on making the blood thicker. He called it, the chylomicrons contributing to making the blood thick. And he would show how that would drop the oxygen delivery to the tissues. Okay, and he felt it was damaging the blood-brain barrier, increasing the risk of multiple sclerosis. Here's the work of Peter Quo. He's a cardiologist in Pennsylvania in the 1950s. He took a bunch of patients with coronary artery disease and cardiac angina, and he fed them high-fat meals. He checked their blood lipids every 30 minutes, and what he found was that peak lipemia, he got a match for causing peak angina. Okay, pretty dangerous thing to do. He could have given these patients myocardial infarctions. And so then in the 1960s, Ansel Keys had shown conclusively that elevated saturated fats associated with increased coronary artery disease. So people thought, well, PUFAs are the way to go. Let's just use PUFAs, omega-6 cooking oils. That ought to prevent coronary artery disease. But what they found was, Peter quoted some of this work, but also a couple of ophthalmologists, Meyer Friedman and Ray Rosenman. When you feed patients PUFAs, polyunsaturated fatty acids, omega-6 cooking oils, they get even more prolonged sludging of the blood, thickening of the blood. And, they would start out in the morning at 8 o'clock in the morning, and their lab workers were getting pissed off because the blood would still be markedly thickened, going into the night, and they wanted to go home. So you're not going to win the game with, these cooking oils are terrible. They're really toxic. This was just some research studies showing all the red blood cells sticking together. And, you don't want to be eating all that fat. Here's another paper by Swank showing how you get decreased oxygen delivery to the tissues. Okay. Changes after large lipid meals, the amount of oxygen available in the tissues was reduced. This was greatest following cream and other highly saturated fat mixtures. It was less with the very unsaturated oils, including safflower and cod liver oil. It was intermediate with the MUFA olive oil, but olive oil is not a pure MUFA, by the way. It's not just, oleic acid, omega-9. It's also got some sat fat in it. It's got some omega-6 PUFA in it. Okay, so anyways, that was a lot of work by him. And the main spot you get atherosclerosis is at branch points. The high blood pressure caused by the thick blood hits the median divider. Let's say this is external carotid, internal carotid going up to the brain. This goes up to the face. And when it bounces off the median divider at the branch point, it comes back, and there's some retrograde eddy currents. And there's also a lot of turbulent flow. And that is sensed by the endothelium as abnormal potential injury to the vessel. It starts to shed its antithrombotic glycocalyx express prothrombotic molecules, and you form a blood clot right there. I look at CT angiograms every day, and I can tell you this is where you form the blood clot, okay? And then the body ends up in a steady state of forming clot and removing clot. And so the healthier the person, the faster they'll remove it and hopefully clear the whole thing. But as they get older, they get less able to clear that clot, and it gets bigger and bigger until it could potentially occlude the vessel, or a piece breaks off and embolizes distally and causes a stroke. The main thing to know about an endothelial cell, the lining cells of an artery, is that they make nitric oxide, so NO, nitric oxide. It's a gas, so it diffuses out into the lumen and inhibits platelets, preventing them from clotting. That's a good thing. It diffuses back into the arterial wall, and goes into the vascular smooth muscles and causes them to relax. So the artery can vasodilate, open up its diameter. So it's a very good thing. So you want your endothelial nitric oxide working normally. All right, here's an atherosclerotic plaque. And just to show that it's a blood clot, okay? That's a really important thing. Trust me, you need to know that. Atherosclerosis is a blood clot. Once you get that and you study atherosclerosis, it'll make a lot more sense to you. And by the way, I used to think the vascular interventionalists like myself, the cardiologists, cardiothoracic surgeons, the vascular surgeons were the best experts in the world on atherosclerosis. But I learned a lesson the hard way. The best atherosclerosis experts are the pathologists. And there's a simple reason for that. If you're a cardiologist, you have to promote stents or they'll throw you out of the business, okay? If you're a surgeon, you have to promote surgery or they'll throw you out of the business. And whereas a pathologist doesn't care. A pathologist does not care how atherosclerosis is treated. They just look at it under a microscope. When they look at it under a microscope, they go, hey, it's a blood clot, okay? Okay, so anyways, you can reverse the necrotic core, the dead cells, the lipid core, the fat accumulation in the macrophages, some of the more acute clot. To the extent that's present, you can reverse that. But the calcified product component, it's unlikely to reverse that. The acellular fibrous tissue, scar tissue, you're unlikely to reverse that. But once you start eating a healthier diet, you get off the salt and all the high fat, the ability of the endothelial cells, the lining cells of the artery to produce nitric oxide, the vasodilator, will increase. So you'll get some benefit in just a couple of days. Then the rest of this will continue to partially reabsorb over the course of weeks to months. And, you'll never get it 100% back to normal. Nobody's going to be 18 years old again. But you can really improve a dramatic amount. I've seen lots of people who could barely walk half a block, vascular claudication. And then after they've gone down this path of low-fat vegan, they're able to walk, they're able to walk for miles, even start running and stuff. Good distances. All right, so now we're going to talk about MUFA, monounsaturated fatty acid, in particular olive oil. And so olive oil has this great history going all the way back to the ancient Greeks. If you look at Odysseus, he was the great hero of both the Iliad and the Odyssey, the Idiot and the Oddity. Okay, his bed back in Attica with his wife Penelope, it was built around a tree, an olive tree. Okay, I got some Greek friends, man. If I criticize olive oil, they get pissed off at me. Okay, but it's so intrinsic to the culture and the society. All right, but in the real world, the modern world, there's problems with olive oil. First of all, a lot of it is fake. It's so expensive and profitable that if you just take other oil and you bottle it and call it olive oil, you can trick people, okay, and sell it. And that often happens in the United States. Now, in some other countries, like in Italy, they take it much more seriously and they regulate it much more carefully. But it's not as carefully regulated in the United States. And there is some chance of a person, a lot of people are kind of clueless. They just go by whatever the label says of potentially getting ripped off, okay? But I would say even if it's perfect, I wouldn't eat it. And the reason I say that, it's all liquid fat. The highest caloric density of any food is these oils. They're 100% liquid fat. So they contribute to obesity. It's not essential. Your body can make it to the extent it needs it. It increases insulin resistance, meaning it predisposes to increased risk of diabetes. It decreases arterial vasodilation. So it's not good for your arteries. It does contain some saturated fat and some other fats, omega-6 and whatnot. Okay, so because it only has one double bond, it's less prone to lipid peroxidation because you don't have a methylene bridge carbon. But I don't recommend it. Let's see, what else on here? It increases postprandial triglycerides, unlike omega-3s. Here's a bunch of literature studies if you want, but I would recommend avoiding it. It's just more liquid fat. And there's a whole bunch of other studies. It increases clotting factor number 7. It also makes your blood thicker. So I wouldn't recommend it. It's still atherogenic. Okay, omega-6 fats. These are just a total loss in terms of the cooking oils. Never have a cooking oil, okay? If you just eat plant foods, you will get the good omega-6 fat, the linoleic acid in its natural form. It won't be distorted. All these cooking oils, they tend to be significantly distorted just from the heating and having lipid peroxidation products that are then toxic to your own membranes. And fats are a bigger deal, I think, than carbohydrates or proteins with regard to cooking, especially with these oils, because they get more distorted and we absorb them in bigger pieces versus the amino acids. get broken down individually or monodipeptide, tripeptide for a protein. We only absorb small pieces at a time of them. Same thing with carbohydrates. But with fats, we can absorb a big fat in its entirety. Okay, now this is a slide from a lecture by this guy right here. He's a real smart guy. His name is Chris Knob. He is a ophthalmologist, and he did a pretty thorough study of dietary patterns around the world with regard to why are people getting so fat and diabetic. And what was interesting about it was he came to the conclusion the number one contributor to modern obesity and diabetes, in his opinion, was the increased intake of vegetable oils, omega-6 cooking oils. Okay, and he showed that the curve for increasing intake of omega-6 cooking oils parallels that for the increase in obesity and diabetes. This was done in Japan, but he got the same results in other Asian countries and in the United States. And what he pointed out was the intake of saturated fats has not changed that much. Okay, and he might be a little biased. He tends to think that eating meat, if it's grass-fed organic meat, can be a relatively healthy thing. But be that as it may, what I wanted to point out, though, was this omega-6 fats are, I think, much, much worse than people realize. You really don't want to eat anything with these oils in it. They're toxic. They're genuinely toxic to your health. And he also made the point that sugar did not correlate that well. It had been elevated compared to the distant past for a long time without any increase in obesity. And that, now don't get me wrong, sugar could be divided into glucose versus fructose and all that. And I do think fructose, when it comes in the context of high fructose corn syrup, is obesogenic. But I'm still making the point, the vegetable oils were an outlier as being dramatically bad. And what those are is omega-6 cooking oils. And again, I don't think it's the omega-6 per se themselves. It's the distorted omega-6 produced by heating up and processing of these cooking oils. You can't win with them. There's no such thing as a good cooking oil, in my opinion. Okay, why do doctors prescribe the fish oil? Like we said, because it lowers triglyceride, has a mild anticoagulation effect. They thought it might be cardioprotective or good for the brain. I don't think it's good for any of these things. I don't think there's any significant benefit to eating it, except if you want to immunosuppress, because let's say you had an autoimmune disease and you couldn't get it under control by avoiding things that cause leaky gut, avoiding toxins that predispose to autoimmune disease, avoiding gluten and gluten sensitivity like things. Okay. So in that context, I could see a role for it. But another point I'm going to make is everybody would talk about, well, we don't convert enough of our omega-3s, source things like alpha-linoleic acid. That's a C18 with 3 double bonds. We don't convert enough of that to DHA. DHA is here, C22, 22 carbons, 6 double bonds. So we need more ALA, or we need to supplement EPA and DHA. I totally disagree with that, because the body only converts probably 1%, at the most 5% to this EPA, DHA stuff. We really don't need much of this. As a matter of fact, the omega-6 linoleic acid, the C18, 2 double bonds, that's actually super important for our mitochondria. We're going to talk about that in just a moment here. If you have these ones, because there's so many double bonds, that means there's tons of methylene bridges, and that means you're high risk for just undergoing oxidation, lipid peroxidation, going rancid at room temperature. I mean, the purpose of those things in a fish is that they can survive with freezing temperature, okay? We don't need those to seek out extra amounts of those. We don't live in these super cold climates, okay? And all the people promoting them, they're always going to say how great they are and how there's minimal side effects. Most of the research you'll see on this, it's all industry funded. They try to make it look good. Causes obesity, insulin resistance, increased diabetes risk, all bad. Okay, and then also, if you look at the fish supplements, very often you're not getting what you think you are. This is just one study of a whole bunch of supplements, and they found out very often there was not the amount of EPA or DHA claimed on the label, and they were very high in oxidation products and peroxide contaminants, and they didn't meet their so-called quality and purification criteria, okay? That's why they'll smell like fish, because they're rancid. Okay, fish oil supplements, what do? Even though they lower triglycerides, they increase factor 7 clotting factor, they increase blood glucose, from the form of insulin resistance, increase in diabetes risk. Another study on them, the marine ones from fish were worse than the plant ones, but they still increase the risk of diabetes, which is the big deal. Diabetes is one of the major highways to health hell to make yourself sick. Okay, this is just, summarizing some of the fats here, but okay, this picture is a little more useful. This is the C18 series of fatty acids. So these means that these are fatty acids that have 18 carbons. So the saturated fat has 0 double bonds. This is how they're written. Here's the carbons. Here's the double bonds. Okay, here is your olive oil, oleic acid, 18 carbons, 1 double bond. Okay, and it's going to be at the 9 position, so that would be an omega-9 fat. Okay, here is linoleic acid, and this is an important one to know. It has 18 carbons, 2 double bonds. There's a guy by the name of Brian Peskin. He's sort of a researcher of PUFA fats, and he's an expert on the subject. He also sells them, so of course he's biased, but he's a smart guy, and he likes to call these the PEOs, parent essential oils. So the point that he would make is that there's only 2 essential fats, and that's this one right here, linoleic acid, C18-2, and ALA, alpha-linolenic acid, C18-3. Everything else, EPA and DHA, those are not essential fatty acids. Those are what you would call derivatives, meaning that the omega-6 things like arachidonic acid are made from linoleic acid, C18-2. And the omega-3 derivatives, EPA and DHA, they're made from this one, ALA, alpha-linolenic acid, okay? So the only things you would need to have some of in your diet would be these 2 right here. These are the only fatty acids. There's only these 2 that are essential. The omega-6, I just remember it as LA because that's a reminder. It's 2 letters and has 2 double bonds. And I remember this is ALA, so 3 letters, and it has 3 double bonds. And if you notice, that's not so bad. So this is only going to have 1 methylene bridge carbon. So it's relatively resistant to lipid peroxidation. This one has 3 double bonds, so there's going to be 2 methylene bridge carbons, so a higher risk of lipid peroxidation than LA, okay, but still not that bad. When you talk about their derivatives, once they're converted, for example, let's say into DHA, that has 22 carbons and 6 double bonds. That's an important thing, underlined in red here, 6 double bonds. That means tremendous vulnerability to lipid peroxidation. Not good. Okay, so one of the reasons why I was curious about this is I was trying to understand how is oxygen transported across a plasma membrane. That's super important because we have to oxygenate all our tissues. We need that oxygen for better athletic performance. I was interested in that. We need that oxygen so the cell survives and you don't become demented. I was interested in that. We need oxygen getting into the cell so it doesn't transform into becoming a cancer cell. So for all those reasons, it's of fundamental importance to understand how oxygen gets into a cell, gets out of a cell. So here's oxygen exiting a red blood cell. It's bound to hemoglobin. It exits the cell by partly through diffusion. That means it just passed through the cell membrane on its own. And that's what I was taught many years ago in med school. Okay, but what they found out now is that it actually has carrier channels, and one of them is called the aquaporin channel, most famous for also, being related to water transport, and also the rhesus channel, which is related to the blood antigens in your red blood cells. And they actually found that there's also another channel. They haven't specifically identified it yet. But the point I'm making is that now turns out that about 90+% it is thought of oxygen transfer across the cell membrane is related to these carrier channels. Okay, that's a big deal because, Peskin in his earlier research, he had come to the conclusion that the most important thing for getting oxygen across a membrane of a cell was the omega-6 fats. But it looks like that's not the case. It's more important that it's going through. This is pretty recent information. When is this paper from? I don't have the date right here, but I know it's just from the last. It might have been 2017, I seem to recall. Okay, so what I'm trying to say is this is pretty recent information, and what this says to me is that the omega-6 fats are not as important as I thought for oxygen transport. They might be related to the remaining 10%. I don't even know if they are. And that's kind of a big deal because that made me think if it had been the case, I would have thought eating raw was more valuable because you wouldn't have any distortion of your omega-6s. But, I'm not sure how I want to mean. So basically, here's the old school way of looking at diffusion. The little blue circles are the oxygen. They pass through. Here's a phospholipid bilayer. This is the polar heads, the fatty tails. So the oxygen goes from the red blood cell to the tissue. All right. But if it's got channel carriers, they can just speed everything up and the rest of the membrane doesn't matter as much. Here was sort of the Brian Peskin theory of oxygen transport across the plasma membrane, bouncing across from these omega-6 double bonds and methylene bridge carbons, okay? And like I said, there might still be some validity to that, but it turns out it's probably a relatively minor component. All right. And then here's the more modern thing with the aquaporin and the rhesus channels. The oxygen is primarily going through those. Okay, and then why is this kind of interesting? Because this is a basic important thing. I spent a long time trying to understand this, and there's really only about 5, ballpark papers on the subject, and another 5 peripheral papers. Almost no research has been done on this. So here's a fundamental thing in life: getting oxygen into a cell to improve athletic performance, to improve, to prevent cancer, to prevent, other types of cell injury, apoptosis, brain cell death. And no research is done on it. You know why? Because a company can't figure out how to make money off this. And it's really kind of annoying. Back about 1980 or so, the government started funding less research. Okay, so now more and more of the funding came from industry, and because the funding's coming from industry doesn't really care about research. They care about promoting their product, about selling their product. So there's very little just trying to understand what is happening type research, and there's much more of promote a product research. So if you look at the medical research, it's a big joke. It's always, how can we make a drug and win the lottery by selling it? And there's very little done to figure out how things actually happen and what works and what doesn't work. Okay, here's lipid peroxidation, methylene bridge carbon, loose grip on its electrons, the hydrogen located in between the two double bonds. So this can undergo lipid peroxidation. You two oxygens in a row attached to the molecule. That's called a peroxide. And then this can itself is a free radical, meaning there's an electron in its outer orbital that is not matched with another electron, and that can then react with an adjacent molecule and cause a chain reaction and destroy the whole membrane. So these PUFAs, where you got all these double bonds, you got tons of these methylene bridge carbons, they're very much at risk to undergo lipid peroxidation just at room temperature, yet alone in our body. Okay, and it becomes highly relevant because cardiolipin is a special type of phospholipid in the membranes of your mitochondria, like your inner mitochondrial membrane. And they got this unique structure that's almost like a double phospholipid. So this is a glycerol, this is a glycerol, this is a glycerol, 3 glycerols, okay? And then you've got 4 fatty acid tails, and these are linoleic acids, LA. Remember, that's the omega-6, 18-2. And these also attach to the proton pumping complexes on the inner mitochondrial membrane. And the relevance of all this is that this is how mammal mitochondria are designed, and this is what works. If you start supplementing with tons of these omega-6 fats, omega-3 fats, you can damage these mitochondrial membranes. So excessive intake of omega-3 supplements can damage your mitochondria. I think that's a big deal. Okay, talking about how cardiolipin can undergo lipid peroxidation and destroy mitochondria. Here's just one paper on the subject. That's a good paper. Okay, now here we'll get into some more. If you increase the omega-3 supplements, you increase omega-3 substitution into your mitochondrial membranes, and that will cause increased vulnerability to abnormal sensitivity to high calcium in the mitochondria and your ROS, reactive oxygen species. So your mitochondria become more fragile, prone to damage. It's not good for your mitochondria. Here's another paper, DHA, that's our C22 6 double bonds omega-3. It lowers cardiac mitochondrial enzyme activity because it replaces linoleic acid. That's a C18-2 omega-6 acid in the phospholipids of the membrane, of your mitochondrial membranes. So when DHA replaces cardiolipin, instead of having the 4 linoleic acids, omega-6s, C18-2s, you get these DHEs in there, those big monsters, C22-6s. They will screw up the mitochondrial membrane because they don't bind effectively now to the proton pumping complexes of the inner mitochondrial membrane that are important as well for electron transport. And that's how we produce ATP. That's how we make energy. We are not made for this. And you'll get a significant decrease in mitochondrial function. I would describe omega-3 supplements as mitochondrial inhibitors because of this. And I would not take them. I would never take them. I mean, the only way I would take them is, like I said, if I needed immune suppression because I couldn't otherwise get an autoimmune disease under control. All right, so this is just showing that some of the cardiolipins are bound to cytochrome C, and if you trash all these cardiolipins, you can just get the mitochondria going to apoptosis, open up the permeability transition pore and all that. Okay, here's just an example of DHA. Okay, docosahexaenoic acid. All right, so this means 22 because there's 22 carbons. This means hex means 6 because there's 6 double bonds. And they're all cis double bonds, meaning that the hydrogens are on the same side of the molecule. But what I wanted to show you was this is 6 sites of methylene bridge, all the pink ones, okay? The pink targets, if you will. And these are all methylene bridges. These are targets for lipid peroxidation. So this is highly, highly, highly vulnerable to lipid peroxidation, even at room temperature, yet alone body temperature. So I think it's a bad idea to supplement with these. That's my opinion, because you're going to end up with a bunch of lipid peroxidation products. You're going to end up with increased insulin resistance, increased risk of diabetes, increased risk of lipid peroxidation, potential for decreased mitochondrial function. I wouldn't do it. I was going to talk a little bit about memories. Not much time for that. Okay, let's see. Also, yeah, we all know there's tons of lipid peroxidation in omega-6s. Well, you'd expect it to be worse in these big omega-3s because there's more double bonds. This is just one paper discussing that subject of, and like I said, when they studied these omega-3 supplements, there was tons of lipid peroxidation in the supplement. Because, when you eat a plant food, it comes to you protected in the plant, and then your body absorbs it pretty quick. Versus when you have some supplements sitting on a shelf for weeks or months, it's a much higher risk to, over time, undergo oxidation and form lipid peroxidation products, rancidity. All right, it's not cardioprotective. They spend tons of money trying to show it's cardioprotective or that it prevents dementia. And these are all the studies if you want to see them. And they can't do it. If it really worked, they would do a randomized control trial and just prove it. But they can't do that because it doesn't work. It's my impression from having studied it. Okay, and it causes immune suppression. This one thing is in mice, and it increased the risk, supplementing with omega-3s increase the risk of metastatic disease because of immune suppression. Okay. I don't see any good mechanism for it to protect against decline, and tons of papers show it does not correct against cognitive decline. There have been some papers that have shown that it might have a benefit, but in my opinion, I would expect that they're industry funded, and I wouldn't believe them. I don't see a mechanism that it's going to work. Your action potential is conducted primarily through your ion channels, like your sodium ion channels. So I don't think DHA is going to change that too much. Okay, so this is just one, pretty good study. No benefit. There's a whole bunch of other ones. And like I said, too, this is something that these supplement companies have a lot of money and they're trying to make this happen. And when they want to try to make something happen, they'll run the same study, a bunch of times until they get a positive result. Then they'll just publish the positive result based on random chance. So the fact that they can't really show this is a good indicator that it doesn't really happen. All right, there's something called a hype and bust cycle of supplements. And usually you see this with big money foods. And what I mean by that is, this guy, Jeff Nelson, he gave me the idea for this phrase. The industry funded money puts a health halo around the food, saying, oh, isn't it wonderful? They do some industry study, bogus papers that make it look good, and they promote it as much as they can to sell it. Then a little more time goes by and people start to realize, gee, this is not necessarily beneficial, probably of no benefit. Okay, so the health halo is starting to decombust, break apart. Even I'm fading it to orange like the autumn leaves as they're falling off, and even combustion, like orange is like a fire. It starts burning up this so-called fake health halo. And then fish, we are starting to now more clearly understand it's not good for our health. So I drew little devil horns on there. And for omega-6, we know omega-6 oils, anybody that studied it, they're a poison. You don't ever want to eat them. And F- in the water, when it first came out, oh, it protects your teeth. You really ought to have this. BS. It's a poison. It lowers IQ. It's toxic. Okay. And so what I'm saying is, in my opinion, these are all bad for health. Probably the least bad out of all of these would be the nuts, but they're still super fat. I wouldn't eat any of this stuff. Caffeine, coffee, tea, nuts, algae, omega-3s, flax. I got to study it more, but I mean, the last thing in the world I want to eat is something thousands and thousands and thousands of times more estrogenic. Okay, I'm proud of being a man. I'm an old-fashioned man. I'm proud of being a heterosexual. I'm proud of being strong. Okay, I'm proud of my traditional values. Okay, so I don't want to, estrogenize myself. Okay, it's sort of like it's a popular thing to do in the modern world as our country's gone insane, but I do not seek that path. Okay, therapeutic potential of omega-3 PUFAs and human autoimmune disease. This is just one paper talking about how it suppresses the immune system. So again, if you're treating an autoimmune disease, that could be relevant. But if you're just a regular person, why would you want to suppress your immune system, increase your vulnerability to cancer and infection? Okay, let's see. What's this? Can humans get enough from plants? Yeah, there's lots in plants. That's where the fish gets them from to begin with, okay? And vegans are not deficient in omega-3s. And the cardiolipin, it wants those PEOs, the parent ones, the omega-6s. That's what you want. If you overload yourself with omega-3s, you can kind of push out your omega-6s a little bit. We're not going to get into all the biochemistry of that, but that is a real thing. Okay. And here's just showing some of the numbers of how there's significant amounts of omega-6 and omega-3s in the common plant foods. So you get them from eating that. Okay. Nathan Pritikin, interestingly enough, a guy who did tremendous study of lipids, said All you got to do is eat one bowl of oatmeal and you'll get all the linoleic acid, omega-6 that you need. Okay. It's impossible to be deficient in fat. And I would agree with that, having studied it. I read all his works on lipids. Basically, they took populations or groups and they feed them less than 1% fat, 0.7% fat, primarily this linoleic stuff. And the populations did really well in those studies, okay? And all these populations eating 1% fat on a rice-based diet, a potato-based diet, a sweet potato diet, they did fine, okay? You're not going to forget about being low in fat. This good fat stuff I said is a bunch of nonsense, okay? And you also get the short-chain fatty acids produced out of your fiber. I talked about that as well. Okay, so then people say, well, what about an evolutionary perspective? I'll give you an evolutionary perspective. So one theory is that humans all originated in Africa. That's not necessarily true, and I don't know for sure if it's true or not. There's another theory that actually they originated in Europe and then they went back to Africa. I don't know for sure, but the reason I show this is just because there's something funny about it. Okay, so going to the watering hole, you know, for these animals is a little bit like the modern person going to the gas station. Okay, you're vulnerable at that time to a predator. Like here's a big crocodile coming out of the watering hole chasing the gazelles here. Okay, but what I'm trying to talk about is it's a hot place. Omega-3 in fish is, you know, like Antarctica, okay, freezing water to prevent them from freezing. In a hot climate, if theoretically we came out of there by evolution, and by the way, I think evolution is overrated for human origins, but that's another topic. And then people say, if you don't say you think evolution explains human origin from chimps, you say, oh, you're stupid or you're anti-science. I majored at Stanford in evolutionary biology, was an A-plus student, okay? I know a lot about it. I've studied it in great detail. And there's good reasons why I'm not so sure we evolved from chimps. I kind of don't think so, okay? I actually believe we were created in the image of God based on scientific knowledge. I've studied it in great detail. Okay, but anyways, our theoretical cousins, the chimps and the gorillas, they don't eat any fish, okay? And being in Africa, they don't need too much omega-3s to prevent them from freezing to death. Okay, and intrinsically, a fish, when I look at a fish, I find it kind of disgusting, okay? You put a bowl of fruit on the table, I salivate. We're made for that, okay? And then the so-called health of the Asian populations previously attributed to fish, they ate hardly any, most of these populations, okay? And it's more likely to do the rice and sweet potatoes, for example, in Okinawa. Okay, another thing talking about chimps. You're going to hear a lot of people tell you, well, you know, chimps are so much like us. Their DNA is 95 to 99% like us. In my opinion, that's BS. What they're going to talk about is a small portion of the coding DNA, okay? I'm going to say these two fraternal twin girls, they look to me about 90, 95% alike, okay? This big chimp doesn't look like a human at all, okay? You know, like I said, every man, when he sees a woman, he can't help it. His mind, in the back of his mind says, is she attractive or not, okay? And what I'm saying is, she's attractive. Jane Goodall, the famous chimp researcher, okay? A chimp, it looks like a giant spider. There's nothing attractive about it at all, okay? So don't kid yourself. Don't be a chump and start thinking that you're basically just a talking chimp. We're very different than chimps. Our brain's about 3 times as big as a chimp, okay? All right, okay, and this was getting back to that joke, you know, why do women have big butts? Because they store their omega-3s on there, and then, like I said, it's like a peacock display. You see that her hips are wider than her waist. That's attractive in a man's brain because that makes you think she's fertile. I think we're just programmed that way, you know, biologically to enable us to reproduce, you know, even if we're illiterate and we don't take health class in high school. Okay, this was just showing the studies showing the increase of cancer with omega-3 supplementation. Okay, the big one, by the way, was probably, this is the most important one, Brasky. They repeated it several times and confirmed it, that omega-3s increase the risk of prostate cancer, okay? And if it increases the risk of prostate cancer, a lot of times what increases prostate cancer increases breast cancer risk. So I'm not saying that it does. I don't have proof of that. I don't know that, but I can just say with the estrogenic chemicals, and they don't know the mechanism for sure why it increases prostate cancer, okay? And this were the mouse studies, increased colon cancer, metastases in a rat liver, okay? Okay, and this guy, Brian Peskin, he wrote a paper, Why Fish Oil Fails. That paper was retracted because I think he is quite biased. He's selling, you know, PEO, parent essential oils. So he is biased, okay? So that's why they retracted his paper. But he's still an interesting guy to see his perspective on it. Okay, now nuts. Nuts are another super popular commercial food. They get, you know, tons. These are billion-dollar industries. They put tons of money into promoting their nuts. They're very popular. They taste good. For a regular person like myself, it's very hard to just have one nut. You know, you're going to want a handful, a cupful, okay, and start eating them every day. They taste good, and then you put salt on them, they taste even better, but they're loaded with fat, and there are other problems with these nuts, okay? let's see, the Mediterranean diet is really sort of a way to promote nuts, that and olive oil, for example. Okay. Nuts are super high in fat, 70 to 90%. This one guy, Veg Source guy, Jeff Nelson, made a whole bunch of really good videos about nuts, hours long videos, very sort of obsessive compulsive, thorough in detail, went through all the nuance of all the studies on nuts. But if you really want to study nuts, there's a person who studied them in a great detail. I just think, why would I want to eat something that's 70 to 90% fat? I don't need it. They also have increased advanced glycation end products, along the lines of like with diabetes related problems. And they have relatively high oxalates, which increase your risk of kidney stones. Now, these are probably pretty small risks, the oxalate and the advanced glycation risk, but it adds to your other problems. For what? I wouldn't want it. Okay, the main thing that concerns me about nuts is the high fat. Glycation damage, a possible central mechanism for physiologic diseases and aging. Okay, so you get increased advanced glycation end products from cooking stuff, from meat, from oil, from nuts. Okay, so why bother? So this is just some paper talking about advanced glycation end products. And what I'm showing you is there's tons of it in fried foods, tons of it in roasted foods. All these fried meats are off the charts in the thousands. Okay, olive oil is at 500 for AGEs, advanced glycation end products in foods. Look at an apple. It's got 13. A white rice, a banana, carrots, 10 per serving. Almost nothing. So below 100 means almost nothing. So once again, the plant foods come out looking great, whereas the fried foods look really bad. Like if you take a potato, a good food, and you fry it, the more you fry it, like make French fries, the worse the quality of the food gets. And this was just showing some of these advanced glycation end products in nuts. Look at this. Almonds roasted, 6,000. That's off the charts, 6,000, okay? Cashews, over 6,000. So these roasted nuts are a disaster. I would never eat them. Even if you eat the raw chestnut, for example, it's still over 2,000. That's really high, okay? When you roast the almond, of course, it gets a lot worse. Peanuts, when they're roasted, super high as well. So I wouldn't eat any of this stuff. Okay, and just for a little bit of comparison, a potato, if you boil it, it's not too bad. But once you start frying it, it's off the charts. Not off the charts, it's much higher. Okay, it gets up to about 1,500 when you make it into French fries, which is pretty bad, but not super bad. Fruits and vegetables, nothing, all below 100, really low with these apples, bananas, celery, cucumber, all this stuff. Okay, all right, a little bit of a topic on fat and blood flow. We talked about some of this before. I won't go into too much detail, but the bottom line is when you eat a lot of fat, in particular sat fat, it activates your neutrophils, your white blood cells of your immune system. They release something called MPO, myeloperoxidase, and that is harmful to the glycocalyx, meaning the coating proteins and structural carbohydrates on your endothelial cells, and they slightly increase the tendency of the blood to clot. So it's bad. They also distort your red blood cells. You get more red blood cells that are abnormally shaped. This is a canthocyte, meaning it has a thorn, a spike coming out of it. It just means it distorts the plasma membrane. The relevance being is it's harder for it to deliver oxygen. Also something called echinocytes. Okay, you get some of your cells changing into this shape. Again, you'll decrease your oxygen delivery. You'll increase your predisposition to clotting. You get something called externalization of phosphatidylserine in the outer leaflet of the plasma membrane of the red blood cells. Again, making them less flexible, less able to deliver oxygen effectively. So here's phosphatidylserine externalization, meaning that they go from the inner layer, like facing the cytoplasm, they flip into the outer layer at a faster rate. And that's a normal thing to happen in a red blood cell as it ages, but it happens in an accelerated fashion on high-fat diets. Okay, the other thing is high-fat diets, they tend to have significantly less fiber. The fiber normally would feed the good gut bacteria, and they would make short-chain fatty acids. Short-chain fatty acids are used by the enterocyte lining cells of the colon to make tight junctions and to prevent leaky gut. Leaky gut also means increased intestinal permeability. So when you have increased intestinal permeability, you can get increased bacteria getting into the blood. Plus, even smaller are their endotoxins. So gram-negative bacteria make LPS, lipopolysaccharide. Gram-positive bacteria make LTA, lipoteichoic acid. These are bacterial endotoxins. They get into the blood, and they predispose to clotting. And so you'll take normal fibrinogen, the blood clotting protein, which typically is sort of, let's think of it as shaped like a slinky, cylindrical configuration. That's a secondary protein structure. It's called an alpha helix. Okay, and that will change in a beta pleated sheet, like flat pieces of paper that can stack up on each other. So it makes the blood more prone to clotting and to clot in an abnormal way. It's called amyloidogenic clotting. They're difficult to dissolve, and they increase your risk of having cardiovascular events. It's bad. Okay, their first detectable finding in insulin resistance is accumulation of fat and skeletal muscles. The more fat you eat, the more likely you're going to end up with fat accumulating in your skeletal muscle cells, meaning the more likely you are to end up with diabetes. So we don't want that. This just shows some of the consequences of diabetes and sort of what diabetes is really all about. Insulin, high blood glucose, that's just a secondary manifestation of diabetes. The initial event of diabetes is elevated insulin resistance. So what happens is when you accumulate, under normal conditions, insulin binds the insulin receptor. It sends a message to these cytoplasmic vesicles that contain these blue things here, which are glucose type 4 transporters, GLUT4 transporters. This vesicle diffuses up to the plasma membrane. It merges with the plasma membrane. The glucose type 4 transporters are incorporated into the plasma membrane, and they then allow glucose to come into the cell. That's what should normally happen after you eat. Eating is called prandial, so it's sort of like the Latin medical way to say it is postprandial. So after eating, postprandial, insulin's binding to the skeletal muscle cell and then causing the GLUT4s to go up to the membrane, allowing glucose into the cell. You need to know that. That's important. Okay, excessive dietary fat actually inhibits the mitochondria, and it will cause electron transport to go backwards. Electron transport is like a fireman bucket brigade handing down electrons from carrier 1 all the way down to carrier 4. They pump protons into the intramembranous space between the outer mitochondrial membrane and the inner mitochondrial membrane. Outer membranes, OMM, outer mitochondrial membrane. Inner membranes, IMM, inner mitochondrial membrane. Okay, so anyways, fat will inhibit this, and it'll lead to a backward direction. You'll start to leak electrons down onto oxygen, and that causes reactive oxygen species. We're not going to get into all that, but oxidative stress. There's a whole bunch of other things that inhibit mitochondrial function. So what I'm saying is, a lot of these things are common and they're happening in the background. So you don't want to make it worse by eating a high-fat diet, okay? By the way, when I went through the old medical school biochemistry books and even my more recent copies and my nutritional biochemistry books, and I go through my, the college biochemistry books, they're not going to tell you anything about mitochondrial inhibition. But then I start going through the papers. I real quickly found over 50 inhibitors, and lots of these things are really common, okay? So you don't want to make it worse by eating a lot of dietary fat, especially saturated fat in terms of causing insulin resistance, but the other ones cause it as well. When you have excessive dietary fat on board, it senses something that's been called overnutrition, and a signal is sent to the plasma membrane so that you don't send glucose type 4 up to the plasma membrane. And now glucose can't get into the cell, so glucose accumulates in the blood. So that's how you get elevated blood glucose after eating. So that's called postprandial hyperglycemia. Hyper means increase, glycemia means glucose, so hyperglycemia. Postprandial, when you've got excessive dietary fat on board and that fat accumulating in your skeletal muscle cells. And there's no way to stop it other than just don't eat so much fat, because it's able to get across this membrane by what is called the flip-flop maneuver. It'll get protonated, so it's no longer charged, the fatty acid, and percolates into the outer leaflet of the plasma membrane of the skeletal muscle cell, flips into the inner leaflet, moves into the cytoplasm. Okay, so the more fat you eat, the more it's going to get into your muscles, and the only way to stop that is stop eating so much fat. Okay, normal electron transport, we kind of talked about that. This can lead to reactive oxygens. We're not going to get into that too much, but you can get lipid peroxidation from this process. So when you start backing up electron transport and leaking electrons down into the matrix of the mitochondria and then forming these reactive oxygen species like superoxide anions, that can lead to a series of reactions that ends up causing lipid peroxidation of those cardiolipids. I showed you the cardiolipids a moment ago, those giant monster phospholipids that have 4 fatty acid tails on them. And once you trash those, they bind to these complexes. So the inner mitochondrial membrane becomes dysfunctional, and they're also going to bind to something called cytochrome C. Here it is, cytochrome C. And so when you damage these, they will then lead to damage to cytochrome C, and the whole mitochondria can go into what is called apoptosis, programmed cell death. It's bad. You don't want that. Okay. Over time, you get advanced glycation from diabetes, thickening of plasma membranes, less oxygen delivery. Okay, we're not going to get into all that. That can contribute to cognitive decline. I alluded to this earlier, the fact that you've got glucose type 4 transporters on your brain cells, on your neurons. So in the old books, you'll see, yes, there's glucose type 1 transporters across the blood-brain barrier, allowing glucose to get into the brain. There's glucose type 3 transporters on your neurons that just take up glucose regardless of insulin resistance. And that's all fine as well. But the problem is you've also got glucose 4, and those are insulin dependent. Insulin related. And so if you got insulin resistance in the body, you got it in the brain too. And under times of psychological stress or intellectual challenges, they just won't be able to ramp up their activity adequately. And that can also be harmful to the neuron. So that's important. This is just a whole diagram of leaky gut. So here's a normal gut lining. Here's the abnormal gut lining. Normal fiber feeds the good gut bacteria. They make short-chain fatty acids, SCFA, especially the 4-carbon butyrate, goes into the enterocyte, gut lining cells. They use that to make tight junctions. The tight junctions keep the gut secure, and you don't get leaky gut. That's normal. This whole list of things is what causes leaky gut. If I had an autoimmune disease, I try to avoid all these things first and see if I was able to cure it by doing that. When you got leaky gut, meaning that you don't have the short-chain fatty acids, enterocytes can't make the tight junctions, you get a gap between the enterocytes. And now these bacterial endotoxins like LPS, lipopolysaccharide from the gram-negative bacteria, can get into the body. They can get beneath the enterocyte lining, and they can start causing inflammation. They can get into the blood, cause clotting. You get big chunks of protein coming from an animal. They can have similar amino acid sequences. That's called molecular mimicry, mimicking our own body's proteins because they have similar amino acid sequences and portions that have similar shapes. And antibodies can form to them and then cross-react to our body's own protein. So that's called molecular mimicry with autoantibody cross-reactivity. And that's thought to be the most common mechanism of autoimmune disease. So by preventing leaky gut, you can usually prevent autoimmune disease. There's a couple other mechanisms of leaky gut. We're not going to get into them today. I spoke about it last time. I did a lecture just a month ago with Amy where I went through a lot of this stuff. So if you're interested in autoimmune disease, I would recommend you watch that lecture. Okay, we talked about this already. And then here's the treatment. The treatment is eat your starches. Starches are a polymer of glucose, meaning a whole bunch of glucose molecules all stuck together, wrapped in fiber. They're low caloric density. They stretch your stomach. When they stretch your stomach, you get early satisfaction of hunger. They then pass into your small bowel here. And as they pass in your small bowel, the fiber has to be peeled off by the digestive enzymes before the glucose can be absorbed into your blood. And so it happens gradually. Here's the glucose curve after eating a starch. A slow increase in glucose, and it stays normal a prolonged amount of time. You're in the zone. You feel good. Got a nice normal blood glucose level, providing you all the energy you can want. If there's no fiber, like let's say you eat one of these energy drinks, let's say it was sweetened with glucose, you would get a rapid spike in your blood glucose because there's no fiber to slow it down, but it would also tend to come down rapidly, and that can cause what's called rebound hypoglycemia. You don't want that. So what I'm basically saying is the best food is starches. And I can tell you, I've been a doctor over 30 years. I'm board certified in 3 fields. And the most important thing I ever learned in all those 30 years is that humans should eat starches. Because if they do, and they get the vast majority of their calories from that, like let's say, about 80% or more of their calories from that, it doesn't have to be that much. You could eat 60% starch and then the rest, 45% fruit, and then a little bit of vegetables on top of that. But the problem is fruits are real expensive. Most of us don't live in tropical areas, so fruits aren't always available. They don't store so well. So, usually starches are cheap. They store well. So the easiest thing to eat, and they keep you healthy. So starch-fed populations, they're skinny and healthy. Okay, this is a Spartan vegan. So I called my own version of the diet, which is pretty similar to other low-fat, low-sodium vegan diets. The Spartan vegan. Spartan meaning that it's cheap, it's simple, and also kind of like my background as a former wrestler. So basically, at the bottom of it is your psychosocial things. You want to try to get along with your family, your friends, have good relationships. You want to get your sleep, get your sunshine. Religious people are a lot healthy, so I think that's a good thing. Exercise, maintain some physical strength, and then get the vast majority of your calories from starches. They're the best way to satisfy your hunger. Here are the starches: potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. You could throw in there if you want carrots, for example. Fruits, eat your healthy fruits, get some veggies. And the only thing you're going to need to take is B12. If you want to take extra things, that's up to you. But B12, you'll need to take something. I take methylcobalamin. I take it about twice a month. Some people take smaller amounts every day. That's up to you. All right. So anyways, then I joke, here's my diet nirvana pyramid. I jokingly call the bottom level the paleo, keto, low carb level of health hell for morons, because you just make yourself sick. Typical American eats the SAD diet, standard American diet, and they're fat and sick, and it's a disaster, their health, and they never get better, okay? You can take all the pills you want. You're not going to cure diabetes, hypertension, or the basic problems related to them with a pill. Okay, then the next level up is the Mediterranean diet. And I say that's for the pseudo-intellectual ignoramuses at Ivy League hospitals like Harvard. And the reason I say that is when a person doesn't know what they're talking about, they always just say, well, I've heard the Mediterranean diet is good. So it's a typical easy answer when you don't know what you're talking about. But the Mediterranean diet is a joke. I mean, it doesn't forbid almost anything. It allows olive oil, even other types of oil, lots of high-fat foods like nuts and seeds and meat and fish and chicken. And it also allows alcohol. It's not a healthy diet. Okay. A lot of doctors are lacto, ovo, pesco type vegetarians. That's a little bit of an improvement, but not that big a difference. Filtering your water is another step up in health. Some people are, animal rights vegans or something, and, at least they're switching to plant foods. It's a bigger step when you get rid of all processed foods. Another bigger step when you definitely get a whole house carbon filter, at least have a kitchen carbon filter. Even better, have a kitchen RO filter, reverse osmosis. When they get rid of all oils, that's a big giant step up. Get rid of all added sodium, that's another big step up. And then avoid all this high-fat plant stuff. In my opinion, you should avoid all this stuff: nuts, seeds, soy, avocados, and sweets. And here's dietary nirvana when it's real simple. It's real simple and it's cheap. So when people tell me, oh, they can't afford it, this is cheap. Because eating starches, that's real cheap. And it's simple. All you got to do is boil stuff, Another thing, too, that you'll sometimes see, like soy is made to look good when you just compare it to meat and dairy. And I think nuts are made to look good when you compare them, that the population's eating nuts, you get what I would call a yuppie effect. The same people that want to eat fish want to eat nuts because they think it's good for their health, and they're paying attention and they're trying. So if you compare that population to a bunch of sad diet eaters, sitting around fat watching TV, this population is going to look better just because of these associated characteristics, rather than because of any effect specifically of the nuts or the fish. So anyways, my same old story is you want to live simple like Adam and Eve, but keep your indoor heating and plumbing. And I think that low fat, low sodium, 100% organic, whole foods is best you can do. So that's it.
Well, thank you so much for that awesome presentation. There was so much to learn, and I think that we'll have to watch it a few times just so that we can absorb it all. There's a lot of good information there, and get a lot of comments and questions. Most of the comments are just saying about you and how happy everybody is to be here and watching what you have to present to us today. So Mona Morant wanted to know, why did he say not to eat oatmeal late in the day?
Well, just because oatmeal, I call it a wet food, okay? I'm a guy. I'm 60 years old, okay? And, if you eat a lot of oatmeal at night, then you got to wake up the void. So I think it's great to hydrate yourself earlier in the day. It's a good breakfast food, a good lunch food, but I don't like it for dinner for that reason. You know what? It probably also because sometimes I'll eat instant oatmeal. A lot of times I get like the rolled oats, but sometimes if there was just the instant oatmeal there, I would eat it. That'd be the only semi-processed thing that I would eat is just plain oatmeal with water. But that's the reason, because it's a wet food.
Okay, so you're just trying to optimize sleep.
Yeah. One extra wake up if I ate a lot of oatmeal for dinner.
Well, that makes a lot of sense. Okay, Carrie said, my brother is type 2 diabetic and has gone whole food plant-based, no sugar, oil, salt, and was consistently losing 1 kilogram per week until he broke a tooth and took antibiotics. A week later, he seems to have gained several kilograms.
Yeah, good. I'm not sure.
Good. The antibiotics cause food retention.
Yeah, they're going to change his gut. So hopefully he'll get over his tooth infection and he can go back to eating an optimal diet. Hopefully that'll resolve it for him, as he gets the fiber back. The good gut bacteria will come into play. Right. So I'm not exactly sure why he gained the extra weight, but hopefully this will get him to turn the corner. Sometimes people, they exercise less when they're sick.
Right, and he may not have been chewing as much because of his tooth. Maybe that changed some of the things that he was eating, but that's a good question. And C wanted to know which fats would be temporarily acceptable to make the transition.
Well, a person can do whatever they want. It's just, to me, it's sort of like, what do I think is the healthiest food in the world? Sweet potatoes, because they only have 1% of their calories from fat, and they're also low in protein. They only have 4.5% of protein. So Americans tend to want the wrong thing. They want more protein. No, protein's bad. You want to minimize protein, protect your kidneys, and also it'll have a little bit of an anabolic effect, especially animal protein. So I want to avoid that. You want to minimize dietary fat. It's impossible to be too low in fat. And the lower your percent of calories from fat, the faster you'll get thinner towards your optimal weight. So if I said what fats were acceptable, I mentioned earlier that plant foods like garbanzo beans are about 13% fat. You can have garbanzos instead of lentils, which are 3% fat. You can have oatmeal, which is about 16% fat in comparison with rice, which is only 1% fat. Potatoes, sweet potatoes are all 1% fat. Okay, so that would be an example of what I would consider of fats that aren't so bad. If a person is trying to gain weight, I know some people that are vegans will eat nuts to gain weight because nut is super fat. But I don't want to gain weight. I have a tendency to just gain weight if I don't be a little bit careful about it. So I would not want to eat these high-fat foods like nuts, for example.
Okay, those are very good suggestions. And then I think we caught a question from someone who was watching over on Instagram. And okay, that was Cedarfish said, how much of whole food source omega-3 fats do we really need daily? Like, is 1 tablespoon of flax enough? How many grams of whole food fats?
Well, I think this is part of the American mentality. Let me explain. Americans are sort of conditioned that they're deficient in everything. Oh my gosh, I don't want to be deficient in protein or calcium or omega-3s. And I would say, forget about it. You're not deficient in anything, okay? Somebody starving might be deficient, all right? Most Americans, be worried about being overloaded in fat. Be worried about overloaded in toxins. If you just eat plant foods, you're going to get plenty of omega-3s, okay? I would not worry about it. I've never in my whole life, I've been a doctor for 30 years, I've never in my life seen a single patient that had a problem with not getting enough omega-3s, okay? It's a little bit of a fantasy that's exaggerated by people who sell omega-3s. There are people who sell omega-3s and they're like, you've got to get your omega-3s or you're at increased risk to become demented, okay? That's like one little tiny study of like 65 females, all right? And I'm not even sure I believe it. I think it was like China or something. There's just tons and tons of data saying, it sort of doesn't help. And based on my study of the pathophysiology of it, I would think it increases your risk of having problems. You need your mitochondria to get to pump out your cytoplasmic calcium. So I view omega-3s as a mitochondrial inhibitor, as I alluded to earlier, that they're switching out for the linoleic acids of your cardiolipins and your intermitochondrial membrane. So I wouldn't take any of them. Just eat your plant foods and you get what you need. I think it's sort of a non-issue. It's sort of like, let's say you're selling something. You always want to tell the public, you are deficient in this, so you got to buy our stuff. You have a problem. I have a solution. Buy my stuff. Okay. And so that's what I think that whole thing is about. I don't think it's real. I'm not worried about omega-3s. Omega-3 deficiency is not the problem.
Right. So to be clear, flaxseed, you do not.
I would not take flax seeds either, because I know right now flax is really hyped. But my attitude is, here's regular food. All right. Let's say this is how estrogenic it is. Here's soy. It's this estrogenic. Here's flax. It's off the chart estrogenic many, many thousands of times. What do I want those estrogenic chemicals for? Okay. I don't want estrogenic chemicals. Okay. I'm a tough guy. I'm a wrestler. Okay. I don't like any of this modern crap. I think the world's gone insane. Everybody wants to be a woman. I like women, but I don't want to be one. Okay. Something with that much estrogen, I'm going to want it to cook for me and do a few other things. Okay. I don't want to eat that stuff. It's like, the heck do I need to eat estrogenic fat for? It's fat off the charts and full of estrogen. That's nice, but I'm not interested in it.
Okay, well, thank you for clearing that up for us, because not everybody is familiar with the estrogenic effects. Okay, let's see. We have another question. Oh, so Boomer and Beyond Wellness, she's going to be coming up next. She's asked a question, is it true that exercise helps the protein levels in the body? If so, how does this process work?
Oh, yeah. I just want to finish one last thing on that last question. There's sort of people are programmed to think, I need more omega-3s. I need more omega-3s. And what I'm saying is, I don't think you do. Our body has at least 11 times more omega-6s than omega-3s. And in the brain, it's even more distorted in that way. Our mitochondria need omega-6s. So this desire, I need more omega-3s, I think it's this artificial thing, kind of like deodorant. Oh, I need deodorant. Yeah, when you walk in a room, you say, hey, how you doing? You don't sniff each other's armpits. So what I'm trying to say is, it's this artificially created thing. Okay, I'm sorry about that, but let me get back to this last question.
That's okay.
Boomer. Okay, she said, what about exercise helps the protein levels in the body? If so, does this work? Well, I'm not sure what it does to protein levels, but exercise is one of the best things you could do. Exercise not only makes your muscles better, it makes your brain better. It increases something called BDNF, brain-derived neurotrophic growth factor. So it helps you form new synaptic connections. It makes you smarter, basically. Because you think about a brain, we're kind of conditioned to think a brain means you can do a math problem in high school. But that's not what your brain's for. Your brain is to help you walk down a path in a forest or a jungle and survive, okay? Why do animals have brains but plants do not? Because animals move. As soon as you move, you have to make a value judgment. What do I want as a destination? There's food over there, trouble over there. I'll go towards the food, okay? Got to remember how to get back where you came from, navigate, avoid obstacles. So what I'm saying is you activate your brain when you move, when you walk, when you run, when you exercise. And I've had the experience lots of times I'll be reading a book and I start spacing out. I can't remember, what it said in the paragraph at the end of the paragraph. Then I get up and I walk and I can all of a sudden concentrate and read the book. And so what I'm saying is exercising maintains your muscular strength, which is correlated with your longevity. And it also improves your brain function. The effect it has on protein levels, I don't specifically know, but I think this whole protein thing is another big joke. All these old people are being told, you need to eat more protein, otherwise you're going to become weak, sarcopenic, you're going to lose your muscle mass. And I think that's a bunch of nonsense, okay? I eat probably about 9% of my calories from protein, sort of on a plant-based diet, close to 80-10-10, typical plant-based diet, but maybe a little lower in fat. And what I'm trying to say is I lift weights with a bunch of young guys occasionally. I'll go to the gym. I'm stronger than all the young guys, okay? Not to brag or anything, but the point I'm trying to say is all these young knuckleheads are taking protein supplements, all right? And they got their high testosterone, but they're also, I'll tell you what all the young guys are doing, they're stupid. They're putting their cell phones in their front pocket, microwaving their balls. They sit with a laptop on their lap, it's a low power microwave transmitter as well, microwaving the balls. I think that's why. But what I'm trying to say is, I'm 60, I can do 78 push-ups in one set. You don't need to eat protein to be strong. We never ate any protein, okay? I wrestled on a college team. We all lift weights. I can tell you lots of guys are real strong. We never took any protein supplements. This sort of modern world, I need to take testosterone. I need to take protein. I think it's all stupid, okay? Just sort of get your rest, lift your weights in a progressive way. You're going to get stronger. Just do the work, push yourself to failure. It's not rocket science. You don't need to take drugs.
Okay, thank you. And Boomer Beyond Wellness wanted to clarify if you said that nuts have 2,800 calories per pound.
I don't know, just off my head, I don't have memorized how many calories they have per pound, but I do know they're 70 to 90% fat. That's tons of fat, okay? I like eating things that are 1% fat, rice, potatoes, sweet potatoes, 3% fat, lentils, okay? Something that's 70 to 90% fat, I have no interest in that. There's tons and tons of money. I've read some paper here. There's like more than 40 papers published every year, according to this one expert, on nuts to promote the stuff, okay? Because they know they make a paper and then they tell the news outlets, the news outlets all publish, aren't nuts great, aren't nuts great? You got all these scientists that are starving like homeless people practically. And, the nut company comes along and says, look, you make our product look good, you'll get grant money every year for, into perpetuity, okay? So they write all these papers saying how great nuts are. But, I don't buy it. There's nothing that has that much fat that I have interest in. Why would I want fat? It's bad for my arteries. I don't want it. I mean, what mainly things that keep you young is keeping your arteries open. Why is everybody sick and dying and stupid? Because their arteries are all plugged up, okay? I look at brains every day. I see all these little silent strokes in all these American brains. The average American has a silent stroke by the time they're 60, okay? I don't want that, okay? That's from plugging up their arteries. And all this stuff I said is related to that. High-fat diets, lack of dietary fiber, sedentary lifestyle, diabetes, hypertension.
Wow. Well, thanks for clearing that up. And a big thanks for Boomer and Beyond Wellness. She gave a super sticker to us to help support the show. Thank you. And she's going to be on next week too, to do a nice exercise program for us, which we're all promoting here. So Michael said, I have trouble feeling satisfied without a decent amount of fat.
Well, this is kind of a big, long topic, but usually the starch is the best thing to satisfy your hunger. And the reason is, like I said, it's low caloric density. It's a polymer of glucose. It stretches your stomach. You get early satisfaction of hunger, and then it goes into your gut. The fiber has to be removed by the intestinal enzymes. You slowly absorb the blood glucose. You get a prolonged normal blood glucose, and that usually satisfies your hunger pretty well. What would I say? Maybe if you want to get a little more fat, instead of eating 1% rice Potatoes, sweet potatoes, have some lentils. You want a little more fat than that? Eat some garbanzos, 13% fat. Eat some oatmeal, 16% fat. That would be reasonable. I think those are still good foods. Me personally, I don't like the high-fat things. I mean, you can eat whatever you want, but the more fat you eat, the more atherogenic effect you're going to get, the more predisposed to weight gain potential you're going to get. So,
Yeah, and for some people, when they try to transition off of these foods, sometimes they go in for a little detoxification that makes them feel hungry, where it's maybe just a detoxification experience that they're having. So I agree with you. I especially like potatoes, and I find them the most satisfying of the starches. And Carrie is asking, transition to what? So we were talking about transitioning here. So
oh, well, I mean, changing your diet, transitioning from one type of diet to another. And what's going to happen too is you're going to get a change in your gut bacteria. As you eat more plant foods and you eat more starches, you eat more high fiber plant foods, you're going to get more of what I would call the good gut bacteria, the ones that make the butyrate to protect your intestinal lining cells. So you're going to have a little bit of bloating, you're going to have the farts, but you'll get over that typically pretty quick, within 2 weeks or so. It depends how much you go, 100% change. If you just gradually change, you're going to have those ongoing problems as your bacteria go back and forth, sort of fighting it out for territory in your colon. So I might as well answer I just want to feed the good guys. I don't want to feed the bad guys, if you will. The good guys eat fiber, so that's what I give it to them.
Right. And if you're 100%, then the bad guys will go away a lot quicker, and you won't feel the effects of the transition so much. And we are here promoting a whole food, plant-based, low fat, no sugar, oil, or salt lifestyle, which if you're new here and you haven't heard about what that lifestyle is, it may sound restrictive, but it's actually freeing, and you can actually eat all the food you want until you're comfortably full and not have to weigh or measure, and you will enjoy wonderful, good health. And will probably, if you're on certain medications, work with your physician to actually titrate and eventually maybe even eliminate them. So if you're curious about that, Carrie, you can message me later and I can talk to you some more about that. I want to see if we have any.
Actually, one thing I would say too, I'd just like to address that topic is because a lot of people do say that, oh, well, that's too restrictive. You're too absolutist. I can't do that. I'm not ready for that. And they always say, a lot of people say, I'm cutting down on oil. I'm cutting down on meat. I'm like, look, you can do whatever you want. But basically what I see as the proper attitude is to recognize that Americans don't age well. Any hospital, in Western hospital, there's this endless river of fat, diabetic, hypertensive, cognitively slow people that flood into these places every day. And so what I'm saying is, if you eat the high-fat, westernized type diets, and I think the same thing for paleo, carnivore, keto, you're screwed. Okay, you're going to plug up your arteries, you're going to have tons of health problems, and you're going to take a bunch of pills that don't work, and then you're going to get surgerized. They're going to chop you up, okay? I see that all day long, every day. Every day I see amputations. I see all this stuff, and it's a disaster. All these families sad and crying, their loved one is just stroked out or dead. And I'm like, the proper attitude is, you mean to tell me all I got to do is eat a low-fat plant diet, and I don't got to get all this stuff? There's a way. It's not inevitable that I'm just walking into an ambush. I'm going to be destroyed by high-fat diet and all the related problems. Thank God. Thank God there's something I could do. I'll do it. I'll do it. That's my attitude.
Yeah, absolutely. When I found out about this lifestyle, I was so excited that I could reverse and prevent disease, and I could eat all I wanted until comfortably full. That was a big deal for me because I really do like to eat. And I like to feel energized when I'm exercising. And before adopting this lifestyle, I would exercise daily, but I didn't have as much stamina as I do now. And I'm older. So there it goes. That's a good testimony for that. So, David Poop, what's Dr. Peter Ryder's opinion on dried fruit to get sufficient amount of calories?
Well, dried fruit is kind of like candy, okay? You can eat dried fruit if you can afford it. You're happy with your body weight. Just clean your teeth off afterwards. But then you're talking about a very concentrated caloric source. Sort of like fruit is candy in general, and the dried fruit is even more candy-like, if you will. So I would just say, if your weight is real good and you can afford the calories, and let's say it's part of your exercise routine, then it's okay. But I wouldn't seek it out myself personally. And, if I was running more. I work a lot. So I exercise, but not as much as I want. If I was like a free man, retired, and I could run 5 miles every day, then I would have more I would want more quick calories like that, concentrated energy sources. You know, and a lot of guys who are running distance, they'll like that. But me personally, I don't eat that just for my own reasons, you know, and because of the teeth issue. And I like to keep my teeth. I got all my teeth. I want to keep them.
Yeah. So it seems that David is concerned about calories, and I also recognize that men typically need more calories than women, and so for some men they may not feel that they're getting enough calories, or maybe they don't feel satisfied when they're eating a whole food plant-based diet. So what would you recommend to him that he
Well,
think
yeah,
about?
if you want more calories, if you want quick energy source, dried fruit would be good for that. You know, if you just want to gain weight and you're not in a hurry, you know, the fat that you get in nuts will make you gain weight. But it's just a question of what you want to do. You know, like I said, if you want to maintain your weight or put on more calories, then that's a quick concentrated energy source. So you could do that. But.
Okay, that's good advice. Okay, I think we might have one more question. Let's see. I think. Oh, Carrie wanted to know, has it been shown that phytoestrogen interacts with human bodies?
Yeah, and there is some debate about that. For example, if you talk about soy, there'll be some people who said, well, soy only affects the good estrogen receptor. It doesn't affect the bad estrogen receptor. The so-called bad estrogen receptor, meaning the idea of the estrogen receptors that promote secondary sex characteristics. But that's not correct. It's like the Mueller paper. I've given previous lectures on soy and whatnot. It affects both of them. And, you know, and if you get back before the modern days of all these industry-funded studies, there's papers showing that soy causes premature puberty. And I've also read effects. It has a negative effect on male sperm counts. It has a negative effect on female reproductive tracts. I think there's real problems with it. Now, I don't know to what extent the phyto, you know, meaning plant estrogens, like how much does flax have an estrogen effect on the body? I don't know. Okay. What I'm trying to say is, why would I seek it out? Okay. To me, it's sort of like you just say to me, a food is high fat and I'm not interested anymore. Okay. And then you tell me it's also real estrogenic, and I don't know how much of an estrogenic effect flax is. But what I'm trying to say is it would have to have a lot of positives to make me even consider it. Okay. You know, like going on a blind date, okay? If you already heard, you know, the girl's crazy, you know, she used to be a prostitute or something, you're like, you know, I think I'll pass on this one, okay? So it's sort of like, give me some reasons why I would want to chase flax or soy before I would consider them, given that I know about all the problems, especially soy has.
Yeah, well, that makes a lot of sense. Okay, I think we got caught up on our questions there. So I wanted to ask the Green Warriors if you could please click like to show your appreciation for what Dr. Rogers shared with us today. Dr. Rogers, tell us about what you do and how we can find you on social media.
Okay, so, you know, my background was I sort of, you know, in my I initially started out as an imaging guided surgeon, vascular interventional radiologist, especially. In my mid-30s, I got fat. I was considering becoming an endovascular brain surgeon, neurointerventionalist. But I got fat, and my parents were sick at that time. My mother had cancer. My father had coronary artery disease. And after I searched through all the conventional books and all my conventional medicine colleagues, what I realized, they didn't have the answers. They couldn't really help me or my parents. And I was also frustrated because, you know, I was first in my class, 99% boards, med school and residency. I'm like, how come conventional medicine can't help more? Okay. How come it can't save my parents or me from my problems? And so I was frustrated. I tried to lose weight for 3 years. I couldn't do it. And so then I started reading all this nutrition literature and eventually came across all the low-fat, low-sodium plant-based diet literature. I'm like, wow, here's all the answers. They're curing patients left or right from all these diseases conventional medicine can't cure. So I became real interested in this stuff, and I kind of been studying it nonstop then, you know, for a couple of decades. And I also realized that, you know, conventional medicine, it just wants you to generate billing codes to make money for wherever you work, you know, the doctors, hospitals, clinics, or whatever, versus I see this is an opportunity to really help people. And I like all this stuff. It's fascinating. And this should be where the energy is, but there's no money in it. So I just do it as a hobby. I make a YouTube channel just based on my name, Peter Rogers, MD. I make these videos. This is really where the power is in health, you know, the promised land of health, the exponential way to increase health. And so it's sitting right here. Almost no one knows about it. Doctors don't know about it because they don't learn nutrition, epidemiology, toxicology. So I figured, like, I have a knack for studying this stuff, for learning it. I was like, just about the best biochemistry student in the whole United States when I was in med school. So I have a gift for doing this. I like doing it. So that's why I do it. I don't make any money with it. I just know that it's the right thing. I got to do something. You got some time for your job, some time for your family. The rest you need to sleep. So for my hobby, this is what I chose to do. And I'll try to help people. And that's what it's about.
Well, we definitely appreciate what you do. And we are glad that you're here. We are having a lot of people giving great comments to thank you for being here. So it's been very nice. And we are fortunate because we're going to be having you back as a monthly guest, and you're going to have some more great topics. And you guys we have a playlist on our YouTube channel for Dr. Rogers, and you can look at his past presentations on diabetes, hypertension. He's done many different presentations for us. So I really want to thank you again, Dr. Rogers. You were just fabulous. Thank you for sharing your insights and your wisdom about dietary fats with my Green Warriors. And Dr. Rogers, what's your final take-home message for our Green Warriors about dietary fats?
Well, I think that there's no such thing as good fats. I think that's just a marketing slogan. And if I had to say there's any good fat, it would be just eat your fiber. You'll get your short-chain fatty acids. And if you just eat your plant foods, you'll get all the omega-3s and the omega-6s that you need. You don't even need to think about it, okay? All these healthy, ancestral, endemic populations with the great longevities, they don't go taking omega-3 supplements. They just eat primarily plant foods and then run around all day with their families, okay? And I think we should essentially try to do the same to the extent we can.
Yes, that's very nice. Okay. And then I wanted to thank the Green Warriors. Thank you for being here. Tell us what you're going to remember from this presentation. One of my takeaways is the detrimental impact of excessive fat consumption, which could lead to increased risk of autoimmune diseases through the gut barrier disruption, and highlighting the importance of prioritizing a low-fat plant-based diet for optimal well-being. And I also wanted to thank Jess Tass Voice. She did the countdown. She did the voiceover. She did the promo. And we had a promo that she did for our next guest who had some change of plans and wasn't able to make it. So I'm going to tell you who's coming up next while Jess Tass Voice is on an airplane and couldn't do it for us today. Do you crave a comprehensive approach to fitness that starts with mastering the fundamentals? Angela Fischetti will lead you through her push-pull class, beginning with exercises without weights before advancing to wrist weights and dumbbells. Tune in for a powerhouse episode that will have you feeling your absolute best. Wednesday, February 14th, 3 p.m. Eastern, noon Pacific on Be Green with Amy Live. Well, Green Warriors, your engagement and thoughtful questions in the chat have been invaluable. Thanks for watching on YouTube and Facebook and on Instagram too. And stay tuned for more empowering discussions. And remember, your journey to a healthier plant-based lifestyle is a powerful step towards overall well-being. And thank you, Dr. Rogers. Thank you, Green Warrior. As a special thank you to the Green Warriors, I'm offering you 5 free recipes. So you just go to my website, begreenwithamy.com/join, and I will send them to you. And if you would like to join me and Dr. Rogers, we're going to say my tagline. You can type it into the comments. Are you ready, Dr. Rogers?
Yep.
Okay. Until I see you all again, remember, be strong, be well, and be green. Thank you, Dr. Rogers. Thanks, Green Warriors. Bye, everyone.
Now you can get 5 free whole food plant-based SOS-free recipes from Be Green with Amy. Just click on the link in the show notes and Amy will send you 5 free recipes, motivational quotes, and more so you can be strong, be well, and be green.